Welcome back, everyone. Let's jump right into today's explainer. We're unpacking the super exciting but honestly kind of risky early days of a medical coding and billing career. We're going to look at exactly where you should work, the very real allure of going remote, and why the choices you make in your first few years can
Look at alternative workplace options, then the remote work reality, followed by the downsides of going remote. After that, we'll cover why freelancing is not for beginners and wrap up with the value of on-site experience.
Let's kick things off with Section 1, Alternative Workplace Options.
Your options actually go way beyond just a standard doctor's office or hospital. There's a massive ecosystem out there. The source material points out that you can find great employment in nursing communities, outpatient facilities, healthcare home services, and even practice management firms. You can even work for commercial payers or federal government agencies. The environment you choose totally dictates your exposure. Like, working in a huge practice management firm might give you hands-on experience with tons of different software systems and specialties, whereas a specialized clinic is going to really narrow your focus.
But let's be real, there's a hurdle. It could be super tough for a beginner to actually get hired right out of the gate. A lot of practices are just reluctant to bring on a freshly certified coder who doesn't have office experience. They might already be overstaffed, or maybe they just don't have the time to train someone from scratch. So, what's the workaround? The text offers a brilliant strategy. Accept a job where your duties include confirming each patient's benefits. Starting with patient benefit verification is a proven way to get your foot in the door. It gets you inside the actual office, learning the systems, and proving your worth from day one.
Moving right along to Section 2, the remote work reality.
Working from home in your PJs. It's the ultimate dream, right? Skipping that horrible morning commute, saving cash on professional clothes, and working right from your living room sofa. The text totally acknowledges this massive appeal. The energy, the time, and the financial savings are very, very real. Just think about it. You can put the money you'd normally spend on eating out or filling up your gas tank straight into the bank.
But, and this is a big but, we have to compare that dream against some strict professional realities. Remote access comes with heavy requirements, mostly because you have to maintain rock-solid HIPAA compliance. Since your office has way less influence over what you do at home, you must establish a completely private workspace. The text is super clear about this. You need an area where visitors or even your own family members absolutely cannot view patient information on your screens. Plus, a lot of employers mandate a professional environment with zero background disturbances. That means no crying kids, no barking dogs, you have to operate with complete 100% confidentiality, and you have to do it entirely without direct on-site supervision.
Which brings us perfectly to Section 3, Downsides of Going Remote.
The text lays out some hidden trade-offs of remote coding, and honestly, they are significant. By staying home, you drastically reduce your contact with colleagues. What does that mean for you? Well, you might be the absolute last person to hear about critical changes to coding policies or new office processes. You also miss out on cross-training in bigger workplaces, which can seriously stunt your future employment prospects. Think about it. The employee who is most familiar with overall office practices is always the most valuable to the business. When you're off-site, you just have decreased visibility to management. The guide gives a pretty stark warning here. If you don't find ways to maintain that human connection, you face a much higher risk of being the first one fired if the company ever needs to downsize.
Now let's pivot to Section 4, Freelancing is not for beginners.
At first glance, you might think abstracting codes from a chart is pretty straightforward, just matching things up. But the text reveals a major hurdle. Providers often dictate and document conversationally. It's basically the digital equivalent of trying to read a doctor's notoriously bad handwriting. They use unique medical jargon and phrasing that just doesn't cleanly map to a standard textbook code. Now, experienced coders have mastered the art of decoding this. They know how to gracefully query the doctor to get the right data with minimal fuss. But for a beginner, trying to untangle this conversational documentation without an on-site mentor to turn to for help is incredibly risky.
And just listen to this terrifyingly stark quote straight from the text. Inaccurate coding leads to incorrect billing, which, legally speaking, is viewed as fraudulent claims reporting. The source states, and I quote, "Submission of fraudulent or misleading claims is a crime that carries harsh consequences, including disqualification from federal programs, money being taken back by the payer, and imprisonment." That is serious stuff. If the documentation doesn't support the claim and you make a mistake, both you and the provider are liable. If the provider gets slapped with a fine because of your error, you're going to be the first one out the door, and finding another job after that will be nearly impossible.
So how do we avoid all that? That brings us to Section 5, Value of On-Site Experience. How do you protect yourself from these massive legal and financial risks while still building an amazing, lucrative career? The guide's answer is simple. Step into a physical office to build a secure career foundation. First, you need to gain that hands-on experience in a medical office, hospital, or billing business. Second, being on site allows you to ask immediate questions, which is exactly how you grasp that complex, conversational documentation we were just talking about. And third, and probably most importantly, you get to learn directly from seasoned billers, coders, and physicians. The text notes that these veterans serve as excellent instructors. They provide a safe environment for you to retain crucial precision and pick up the vital nuances of the job before you're on your own.
So, I leave you with this final question to ask yourself. Are you willing to risk federal consequences and career-ending mistakes by isolating yourself as a freelancer or remote worker way too soon? Or will you choose to build an impenetrable, long-term career by learning alongside the veterans in an office setting? The choices you make in those first few years are really going to define your entire trajectory. Please like, share, and subscribe to Decode Healthcare with Harshal.